Okay, class, this is our third and final video, and it's just kind of going to wrap up our content here. So we're going to talk about nuclear medicine last. So nuclear medicine is the branch of medicine involved with the use of radioactive substances for diagnosis, therapy, and for research. Radioactive substances are administered to the patient either by mouth or by injection. The radioactive compounds travel to an organ or area in the body that attracts them and creates an image of that area. The provider may order a nuclear medicine scan for the following reasons: to analyze kidney function, image blood flow through the heart, scan the lungs, measure thyroid function, identify bleeding in the colon, or determine the spread of cancer, and for many other examinations. So you may hear a provider say that they're going to send them to nuke med, and nuclear medicine is where they are sent to have these radioactive substances injected for them to be traveled to a certain body part for them to have images conducted at that time. Okay, so that is all I have for you as far as content goes, but I do want to just remind you that this chapter will be on your final exam. You'll have 5 questions from this chapter in your final exam. And when you go to study this chapter, since I didn't teach it in person, things I want you to really focus on are your responsibilities as a medical assistant. Remember, it's your responsibility to instruct the patient in preparation for radiological exams. The patient needs to know about the procedure, so how it is conducted. They need to understand how to prepare for the procedure, and you need to provide verbal and written instructions. Okay, and I want you to focus also on the different types of tests. So compare and contrast the differences in a PET scan, an MRI scan, and a CAT scan or CT scan. Okay, so focus mainly on those types of things. I do not need you to know those examples of different types of radiograph diagnostic tests. So I don't need you to know about a hysterosalpinography or an upper GI series, lower GI series. Those simply are for learning and for you to understand that there are different types of tests out there and different types of preparation, different types of procedures. So that was more exemplary for you for learning purposes. So mainly when you go to study this material for your final, focus on what your job is for a medical assistant in regards to these types of diagnostic imaging. And then I want you to compare and contrast the different types of tests that we do on patients. Okay? So everyone's going to do great. And of course, if you have any questions or concerns about this material in Chapter 31, please let me know.